Go.
Hi, my name is Haley and I'm going to be demonstrating a dressing wound change and irrigation. So the first thing I'm going to do is check my patient's chart for any limitation and the need for the dressing change. I'm then going to put on any PPE if necessary and perform hand hygiene. I will then identify the patient and I will put the bed up to a comfortable working height. I also make sure that the door and the curtain around the bed is closed. I will then assess my patient for any pain and administer any pain medication ahead of time before the procedure. I will then explain to the patient what I'm going to be doing today and how long it will take, probably about 15 to 20 minutes. And I will make them as comfortable as possible. And I want to make sure that they are also in a comfortable position. The first thing I'm going to do is put on gloves, and I also make sure that I have my supplies gathered ahead of time. I'm putting on clean gloves and I'm going to remove the old dressing. So the first thing I'm going to do, if the tape is stuck on pretty good, I would use an adhesive remover. But this one has been on for a while, so I'm going to use the push-pull method to remove, starting with the borders, the outsides. I'm going to remove the dressing. I will assess the dressing drainage, and then I will assess it, the color, odor, consistency, amount, and I will discard this old dressing. Then I'm going to assess the wound itself. I will assess the appearance, any necrosis, eschar, granulation tissue, tunneling, and assess the outside of the wound as well. And then I am going to measure the wound. So I'm going to measure the length. So it's about 10 centimeters. And then the width, which is about 8. And then I would take one of my Q-tips and measure the depth of the deepest part of the wound. Which is about 2 centimeters deep. Okay. And then next I am going to discard my gloves. And I am going to begin by setting up a sterile field. I'll open it away from me, taking it by the edges. And I want to make sure that I am only holding on to 1 inch around the border. Lay my drape down, and then I can add my supplies onto my field. Then I will be using this off to the side for some saline. Okay, and then I would discard that as well. Then I'm going to also make sure that I untwist the cap, my saline. And also I'm going to make sure that I have strips of tape ready. So it's taking me a little. Alright. So I'm going to make sure that I have strips ready. So next, I'm going to perform hand hygiene again, and then I am going to apply my sterile gloves. Press the inside on my hands, pull these on, and once I have one on, I can now move my supplies around on my sterile field. Okay, and then at this time, I could take my non-sterile hand and pour my saline solution into both containers. I'm gonna make sure that my hands cover the label. And then if the container was already open, I would lip it and check the expiration date as well. And then I can go ahead and put on my second sterile glove. Okay. So I discard. Okay, so at this time, I would apply any a barrier cream or any topic ointments around the wound area. And then I am also going to drop some of my gauze into the saline so that it can soak. And next I'm going to irrigate the wound. So I'm going to take my syringe and I'm going to irrigate the wound from the dirtiest part of the wound to the cleanest, and I'm going to keep flowing solution until it runs clean. Okay, I'm going to make sure to leave it about an inch above the wound, making sure not to touch any of the skin or the wound itself. Okay, and then next we are going to pack the wound. Or I'm going to dry the wound first after irrigating. I'm going to be careful not to touch the wound, staying sterile. Pat it dry, discard, and then I'm going to take a piece of my wet gauze.
Yeah.
Applicator and start packing the wound. And I'm going to take a few pieces of dry gauze, my ABD pad, making sure that the blue side is up. And then apply my tape. Okay. And then at this time I can remove my sterile gloves. Making sure not to touch the contaminated part. And then I would initial and date the wound. And then I would clean up and discard all of my equipment. And then I would make sure that my patient isn't in any more pain, that they're in a comfortable position. I would lower the bed back down to a safe height for my patient. And then I would perform hand hygiene and remove any PPE if necessary.